Hello, I'm Greenbrier Almond. Today I am reading The Stories of a West Virginia Doctor by Harold David Almond, MD. My father has written this book and we are giving a recording now ready for Part 6, St. Joseph's Hospital. St. Joseph's Hospital's early days. When I first came to Buchanan, I was immediately impressed with the quality of St. Joseph's Hospital. The hospital building itself was old and not modernized, but it was extremely well run by the Catholic sisters. In those early years, the sisters took care of the garden, milked the cow, and fed the chickens, in addition to taking care of patients, performing laboratory tests, giving anesthesias, assisting with deliveries, and teaching young girls to be RNs. St. Joseph's had a school of nursing back then and did a fine job of training and teaching. In the 1950s, those of us on staff performed multiple tasks to make sure that a small hospital like ours offered comprehensive care. Sister Matilda, the administrator, was the lab and x-ray technician, as well as EKG technician. She was also a nurse. In fact, Sister Matilda was 1 in 1,000 nurses. She could and did it all well, and did it all for years. The hospital had no pathologist in charge and no x-ray specialist to read x-ray films. Dr. Page read them all once a month. I had a short course in EKG reading at Columbia Medical School, and so I read all the EKG from 1950 until 1970, when the hospital accepted internists to the staff. Then we shared the interpretations of the Q, R, S, and T waves. St. Joseph's Hospital had one of only 4 elevators in Upshur County in 1950. It was extremely busy, taking us from the ground floor to the 3rd floor nursery. The emergency room at St. Joseph's was started in 1956 by Sister Agnestine and me. It was a small room in the 1st floor and rented for $6 a day as a private room. The steam pipes overhead afforded themselves as poles for the IV fluids. The average use was about 1 patient per day, but within a year the census was up to 10 patients per day. About the 3rd month of use, the emergency room opened up the eyes of everyone in town when doctors helped save the life of a 16-year-old shooting victim. Trying to save a teenage shooting victim. The busiest day and the most exhausting I ever had started at 9:30 p.m., February 18, 1957. It had been a trying day with home calls, cases of flu, and office visits. Now it was really continuing with a bang. Dorothy was a 16-year-old who was sitting in a local restaurant with some friends when a 30-year-old jealous suitor shot her 3 times through the abdomen, once through the right lung and liver, and once through her hand. The already long day thus became longer that 9:30 p.m. when the local funeral home ambulance and the patrolman appeared at St. Joseph's Hospital. The bullet holes from a .25 caliber automatic pistol were evident, as was the fact that the 16-year-old girl was in shock. My training in a big Chicago hospital as an emergency room doctor was called up. We started plasma in 2 separate veins and drew blood for typing and cross-match and for blood counts. X-rays showed 3 bullets still in the abdomen. It seemed like the whole town was there at the emergency room that night to help out. We obtained some 20 pints of blood and used 17 of them. We called in the surgical team of Doctors Page and Huffman, as well as the scrub nurse for the next day's operating schedule. One of the sisters acted as the circulating nurse that night. The worst wound was a bullet through the right lung that traveled forward and tore a hole to the liver before continuing through the stomach. The belly was filled with blood, and most of it was coming from the torn liver. Dr. Page tied off the spurting vessel. Then he packed the liver with 36 inches of foam and 36 inches of gauze. Now we began the critical and at times consuming task of examining 9 feet of large bowel and 18 feet of small bowel. All in all, the surgical team found 17 bullet holes in the stomach, duodenum, small bowel, and colon. All were sutured with catgut. Dorothy remained in the hospital for the next 5 months. She had a rubber tube drain placed in her right lung. Her daily temperature was between 104 degrees and 160 degrees Fahrenheit for about a month. Dr. Page and Charleston specialist Dr. James Walker operated and resected the 9th and the 19th right ribs on March the 30th, 1957, so that the right lung could drain better. Another part of the rib was resected on May the 10th, and the pus cavity in the lung was again drained. Dorothy returned home on July 3rd with a tube still in her lung. She received daily dressing in my office for the next 6 weeks. She developed an abscess in the area where the liver had been shattered by the bullet, and she was readmitted for an operation on August the 24th. Dorothy was poor, and welfare paid but only a token of the amount for the extensive care she got from the hospital and 3 doctors. She re-entered school in the fall but developed pneumonia on March 30, 1958, and died after being hospitalized for 30 days. Shortly after she died on April 1958, Dr. Page and I performed an autopsy at 3 a.m. with the following results: pneumonia in both lungs, chronic kidney damage, subacute infection of the heart muscles, and severe congestion in the liver. This tragic case shows one man at his worst, and the hospital and its nursing and medical staff at its best. Adversity generally brings out the best in men and women. This time the best was at St. Joseph's Hospital in Buchanan. Ask, seek, and knock on the door. He was 20, cyanotic and gasping for his breath when the ambulance crew knocked on the ER door one night when I was working my shift. A blood embolus from a leg had thrown him into shock. At 2 a.m. his skin was black and he was fading fast. He did not respond to nasal oxygen I administered while he was sitting in an oxygen tent. His blood pressure was 0/0 and the heart rate was 300 plus. The night nurse didn't quite correctly hear the young patient's plea, "God help me, God help me." Her answer, "We'll help you," puzzled me, but then she promptly said, "Dear God, help all 3 of us." The IV digitalis slowed the heart rate, other medications raised his blood pressure, and by morning he was half alive. By mid-morning he was out of danger. I later thought to myself, ask and it will be given, seek and you will find, and knock and the door will be opened. Watches and gloves. Vi, the head nurse at the PAP clinic that day, said, "Doctor, why do you pull the glove over your wristwatch? Why not remove it entirely?" "I'm a watch tester, Vi," I jokingly answered. The nurse shrugged her shoulder and elevated her eyebrows. "What is the story? You are the only doctor I know who does not remove his watch in the office or in the clinic and in minor surgery." Sometime early in 1950s, Lois and I went to an alumni dinner at West Virginia Wesleyan College in Buchanan. Across the banquet table was a professor of chemistry and his wife from Glenville State College. Professor Richard Brooke was wearing one of the most beautiful watches I had ever seen, and I told him so. He took off the wristwatch and scooted it across the table. "It is yours." I refused, and in fact, I was embarrassed. I felt like a beggar. Professor Brooke sensed my embarrassment, so he explained, "Would you like to be a watch tester and have a watch like this?" My sister runs the program out of the Connecticut office. Timex is now testing their soundproof, waterproof, scratch-proof watches with a new powerful battery that runs the watch for over 2 years. Also, they are testing a watch that has no battery and nothing to wind. I thought that the watch he described sounded great. I could just move my wrist 11 times 11 during the day, and the watch kept on ticking. About 10 days later, I received a similar watch, just as beautiful. A return box contained a note stating that in 9 or so months, I would be notified, and I was to return the watch for another. Never in my days in college or in medical school or in my 15 months internship without pay could I afford any watch like the one on my wrist that day. I used a watch 98% of the time only to use the second hand to count a pulse. I seldom paid much attention to the hour. Here now I was checking the hour and minutes and second hands many times that eventful day. The next day I needed to slip on a rubber glove to perform a vaginal and rectal exam. I found myself taking off the watch and putting it in my pocket. But I am a wristwatch tester, right? So sound, water, vibration, proof, why take off the watch? Yes, I am a watch tester. Perhaps 7 or not 10 times each day, I pulled a sterile glove over that watch and thought nothing of it. 9 months came and I sent the watch back to Connecticut. I got a new watch for my left wrist. About a week after I had returned the first watch, I received a phone call from Miss Brooke, the professor's sister, who asked me in a perplexed voice what I did for a living. I told her that I was a doctor in rural West Virginia. What else? She asked. I told her that I also taught a course at West Virginia Wesleyan College. After her call, I wondered why she was puzzled about my profession and how it related to my testing of the wristwatch. Finally, on a call that night to Helvetia, I realized I was probably the only watch tester who pulled a rubber glove over his watch. I called the next day and asked Miss Brooke if they had found white powder inside their watch. She replied that the laboratory had, but they didn't know what it was. I explained to her that our office cleaned, washed, and sterilized our gloves and used Johnson's baby powder to slide them over the hand. The white foreign material in the watch was baby powder. A day or two later, Miss Brooke called again and wondered if her company could send me 2 wristwatches to wear. I laughed and I told her I did all examinations with my left hand. For the next 9 years or so, I received a new watch to be tested about every 9 months, and I returned the old one. Little did I and the chief nurse of the PAP clinic realize on that day in 1957 that by 1985, all the hospital nurses, lab technicians, and many doctors would be wearing many pairs of gloves all day long. The reason, of course, is the AIDS epidemic. So, in a small way, the Timex Watch Company and I were testing their watches for the future. That completes part 6 of our story.